All right, so all these sessions are going to be recorded and we are going to publish them on the YouTube channel later on. So these are all the introductions of for the team members. Now let's start talking about what happens when you see that you did not pass the exam. So let's talk about what are your options. Like when I say what are your options, I didn't mean like how many attempts you have. Okay, let's be very clear to that. What are your options? Do you feel ready to take the exam again? What's your mental state right now, right? Do you feel depressed? Do you feel that you may want to take a break? Do you feel that, you know what, let me just get done with that? On what basis you want to get done with that? What is your score right now? We have to look at all those practical aspects before we take any step, because let's be very practical with this. Okay, let's be very realistic with ourselves. If you didn't make it this time, there has to be some factor. There has to be some factor that you didn't make it. Were you too weak in the content? You don't feel so? And I believe you, because what I believe that everyone who's going for the exam is okay with the content. They know what they are, that they know their content. That's why they're taking the chance to go for the exam. It's scary. Then what went wrong? Were you not right with your mental state during the exam? Was it too distracted? Were you tired? Were you sick? What happened during the exam? And what do you think you missed in the content when you're looking at a question? You're like, I never read this scenario before. I never read this topic before. So you need to make a list. What are your options? Do you feel ready to go for July, to go for May, to go for September? Do you want to take a break for 6 months? Please go ahead. Nobody's going to judge you. This is your life. You need to do whatever it makes you feel comfortable. Don't stress out. But first, accept the fact what happened during the exam, before the exam, right? If you feel depressed, how do you get out of that depressed mood? I was talking to somebody last night and that person didn't make it. So I will never take the names in the podcast or anywhere wherever we're talking. Let's not talk about that person. Let's talk about another scenario. Now imagine if I give you $1 million, right, Ruchi? Let's talk. If I give you $1 million, would you refuse it or would you take it? Let's be very practical. You'll take it.
I take it. Yeah.
You'll take it, right? Why to refuse $1 million? But if I tell you, I'll give you $10 million, but you won't wake up tomorrow, will you take $10 million?
I won't.
You won't take $10 million. What does that mean? It means that waking up is more important than $10 million. A lot of people are depressed right now because they didn't make it in the March exam. We need to realize what is important, waking up or PCE. I understand PCE is one step in your career. I'm not denying that, but you have to get stronger. You have to be grateful for what you are. You can become a physiotherapist in about a couple more months, right? So look at the priorities around you. Look at what are you grateful for. This is what I do when I feel depressed. I do feel depressed sometimes. I'll start writing 3 things in the morning. What am I grateful for? You do it 3 days, 4 days, 5 days, and you feel that energy. You feel so thankful and grateful about the stuff around you. So try to do that. I understand. We understand about your situation, okay? Most of us have gone through these failures or these setbacks. It's you who's going to stand up again. It's easier than said to be done, but you can do it. So try to get out of that mode. Try to talk with your family a lot, sit with your kids and see there's so much happiness around you. And you can only pass the exam if you stand up again strong and if you make a strategy and you see what your options are. Right? How do you keep motivated? As I said, like you need to start working on the things around you. Make a list of topics. These are my easy topics. These are my difficult topics. These are my tough topics. I think I shared how to improve mock exam scores video about a couple of weeks before. So maybe you can see that and start making your weakness list. How do you start studying again? If you need to talk to me, Ruchi, Faiza, or any of the team members, please go ahead. We want to help you and we want to make sure that you have a good plan before you start working out. You're not enrolled in PCE Final Frontier, that doesn't matter to us. and it has never mattered to us. Okay. So I'm being very upfront right now. Yes, there are coaching programs and we're not the only ones. Okay. Everyone has their weaknesses and their strengths. But if you feel like you're not supported enough, if you feel like you need another perspective, call us. We'll talk with you. We will never ask you if you're enrolled with somebody else or not. What is the best time to go for the next exam? It's a tricky question. There has to be a combination of your mental state and your content. Look at the practical approach. Are you making improvement in your mock scores or not? If you're not making improvement, it's not a good sign to go for the exam again. If you sit to study and if you start thinking about, I studied this before, I think I'm going to fail again because I'm studying the same stuff. That means that trauma is coming back to you and probably you're not ready to take the exam. As I said, it has to be a combination of if you are ready mentally versus if you're ready with your content. All right. And how do you perform differently? You did everything that you were supposed to do in your first attempt or in your second attempt, but you didn't make it. There's still a piece missing. How do you do that differently? Probably this is a one-on-one conversation that we have to make. Probably your story is entirely different story than what I had with one of my students. So you need to come up front and talk about how you did, what you did, how much you did, so that we can figure out where we can make improvements. Right? Guys, anything that you want to add?
I feel you've covered everything. The most important part is to identify the problem.
Yeah.
It's okay to fail. Not that we say that you should fail, but what next if you have failed? What's the plan B? How do you want to see that 4-letter word pass? That's the most important thing. And that's true. We have to keep ourselves motivated. We can take a break, but we need to bounce back always.
Right. I agree. Faiza, anything to add on your side?
Yeah, I think you both have covered everything. There's nothing I have to say. But the thing is, like, I don't want like everyone to get depressed because has to get the results. Like PC is like a journey, you know. You cannot just sit for a month or 2 months to finish, you pass it, walk off. It's like a lot of hard work. It's just like, you know, some people start from a year, some people take 6 months, some people take like more than a year. So this entire journey, they're so exhausted. And when they see the result, they fail, they're totally depressed. They just want to change their careers, you know. To be honest, like most of the mentors have passed in the second attempt. So I just don't say like, you know, you finish, you're done. No, if you have the passion to be a therapist in Canada and you want to do it, people can do it. We are there to help you. People can reach us out, and mostly everything is covered. Ravneet has done everything. So this is what I want to add.
You raised a very important point here, Faiza. You said most of the mentors, we're not saying all, we're saying most of the mentors who claim that we can help you pass the exam have done their exam in the second attempt.
True, that's true.
It's an open question. You can decide if you want to answer this or not. What I've been hearing from last 1 week, ever since the results came out, what I'm hearing that people are frustrated.
Yeah.
And one of the most important factor that they're frustrated is the lack of support from the mentors. And there has been some disturbing events that I came across, that there was a wrong attitude of a mentor. So you can decide if you want to talk about that or not. Like, why are some of the mentors are so arrogant, even though they pass the exam in the second or third attempt? Like, I'm not judging anyone on the basis of their attempt. I'm just saying, like, if you're a mentor, what is that arrogance about? It's disturbing to me, to be honest.
I know, to be honest, it's their personal opinion, how they want to be a mentor. Okay. For me, I want to be known as a person who can help the people who are in the depressed state, who are frustrated.
Yeah.
I cannot comment on others because I don't know what their mentality is, but this is how I want to show myself. If someone is like getting one-on-one mentor with me, or someone thinks, okay, fine, I want to go mentor with Faiza, they should be having a thing in their brain, like, no, after, even if they pass or they don't pass, it's up to them, but still I will be there to support them. I'll be always kind to them. There's nothing like, no, when the person is so depressed, especially in Canada, when you're like, your family's not here, you're staying alone, you just have friends and you're not like living up to the dream, they go in a very drastic situations, so
Right. Yeah.
I should be always there to help them. That's it. That is what my motive is.
Yeah. Yeah.
So,
No, I agree. Ruchi, anything? If you don't want to answer this question, that's okay, because we are not here to hurt somebody's sentiments. And I don't know if somebody's going to take it personally or not. It's just my concern because it's disturbing to me. I think it's not right mentally for a person who's asking for help to talk to somebody who's arrogant,
You can't break a already broken person more. That's something not right. And it's difficult to build them up again.
Yeah.
The most we can do is at least give them space to come and trust us and talk to us, no matter what, even in the journey while they're preparing for the PCE, even after they have passed it or they have failed it. Like, we should be able to give them a space where they can come and share and talk and be themselves. Yeah, they can trust in themselves again. They've already lost that faith in themselves after failing the exam. So the most we can do is be polite and be gentle and really keep pushing them. Yeah. And figure out a plan. That's the most important part. Yeah.
I completely agree. I think when you said you can't break a person who's already broken, man, I felt that. And I really want to request all the mentors, including me. I just want to remind myself that there's only one difference between you and the person who's preparing for the exam, is that piece of paper. You become a mentor if you want to, right after you pass the exam. That means there's just one line between you as a PCE candidate from a PCE mentor, is that when you get that validation that you passed the exam. So please, I fold my hands and I request you, think before you speak. Don't use the words like, if you don't attend my classes, you're going to fail the exam. Please, it's not a good, it's not how we want to build our community, right? We don't want to build our community on negativity. We want to build our community on optimism, right? Okay, as we said, this is going to be a very practical approach in our session. Ruchi, I want you to talk about your student who you helped, and that student had a jump of 300 more points in their exam. So I'm gonna give you that slide and just take your time and discuss the weaknesses of that student and how you build that strength, how you build that confidence, how you worked on the domains, how you identify the weaknesses in that person. What were your suggestions? What were your suggestions on the books or anything that you want to talk? Please go ahead.
So this was the person I had an opportunity to mentor in the past year, and a completely broken person who was totally devastated with the knowledge they had, and they just scored 100 in the first attempt. The deed was done. What can be the next approach was the most important part to be discussed about. We sat and we had a conversation about how things were. We figured out a plan and how things can be done differently. And if this person can do this after a very bad failure, they did have an opportunity to work towards it. They had the courage and the attitude to pass the exam, and they were able to do it. After the conversation I had, there were a few things I could realize and understand. During the first attempt, the motive was to just pass the exam. And that's where we recognized the problem was. You cannot just pass the exam. As Ravneet always says, and this has just imprinted in my mind, you have to become a good physiotherapist. And if you go with the attitude of becoming a good physiotherapist, that's when you know you got it right. We figured out the mistakes that were done. One of the mistakes was not having a study partner. So we were able to hook that person I was able to get in touch with someone else with the similar scenario, and they could work it out together. They both passed the exam. And then we figured out the things that were done in the first attempt that were incorrect. Not making notes, not studying and following the schedule that was given by Final Frontier, just scanning and scamming through the words, not understanding the meaning, not being able to connect the dots. The most important part is if you're not covering your content in a proper way that it should be, you would never be able to use the strategies that you're supposed to use for the exam. So in order to be able to use the strategies, you should really be able to understand the content and absorb the content properly. There were things we figured out in musculoskeletal system, different approach that can be taken care of. We worked in cardiovascular system, how things can be worked, how ethics can be covered. There were so many situations. It was a really, for this person, was a personalized goal setting that we did. With every factor, the first session, I remember we had a conversation of 90 minutes, on an average 90 minutes, and we just spoke about what everything they did in their first preparation. I was just listening, I was making notes, and the second call was how we can make a difference. And the person followed. That's the most important part. They were able to recognize, they agreed to everything we spoke about. They followed, they kept up with the follow-up every single time. And yes, they passed the exam. What's the best part? Like, he was able to make it in the second attempt and it worked great for them.
That's awesome. I think jumping 300 more points have been the biggest success of the PCE Final Frontier. I'll be very honest. We had couple 200 jumps and 100 jumps also, but I think this was the biggest success for any PCE Final Frontier candidate or the mentor. So congratulations on achieving that, and so proud of you that you were able to make a difference in somebody's life.
Thank you. I would just add one most important part in this one. The first time when the student failed was because of them, and the second time when they passed was also because of them.
It's true.
It is the student themselves who make a difference if they want to make a difference. We just stand as a guide. We cannot study on their behalf. We cannot go and give an exam on their behalf. So it's really a student who can make a difference. And this thing, I am talking from a viewpoint of being a student and not being a mentor. You can blame anyone and everyone. You are not going to make a difference until you blame yourself. Be it whatever situation in the life is. That's a huge thing. I would really, and it can be in any part of the life, not just with the exam.
Yeah. No, I completely agree with that. And thank you for pointing that out, Ruchi. You covered very important points and very practical approach. You have to identify, you have to talk to somebody, you have to connect with someone especially who you trust, right? Because that person is going to give you some tips. And as you said, it's the person who's taking the PCE. You can talk to 100 people about that, but who's going to make the decision, who's going to implement that is going to be you. It's going to be someone who's going through the process. So great work. Thank you. I'm going to share some tips. I'm going to share some important things that you can use for preparing for your exam. So let's go to that very quickly. I call it smart study pattern. A lot of people talk about smart study, work smarter than harder, but how much are we able to implement that, and how much we are able to really work that strategy in our daily lives? That's important. So let's take a look on how the smart study looks like. We call it support studying. What do you mean by support studying? Studying is studying, right? You take a book, you start studying. No, support studying. It includes few things like your physical activity. Are you just sitting there and suffering from the backache because you're sitting for like 6 hours every day and you're ruining your body? Do you have enough sleep? Or are you just going through the sleep apnea because you're too much stressed about the PCE? Are you in a right mental state? Are you meditating? Meditation has been one of a game changer for a lot of people, believe me or not. Okay. It's the most underrated thing that's been a factor for somebody's success. But if you're strong here, then you can do anything. Meditation can be a game changer for you. If you're not doing it, that's okay. If you don't know how to do it, that's also fine. But you can have a guide with you who can help you to keep your mind calm. Then breaks and no study days, it's important. Probably try not to have no study days, but it's important to have a study break. Now imagine if I'm talking for 2 hours and I don't drink a sip of water, what's going to happen to my throat? I'm going to be tired. It's going to start hurting. It's going to get dry too much. In order to have a better voice quality, I need to take 1 sip every 5 minutes. Why am I doing that? Because I need my throat to work well. So this is a break. This is a lubrication to my throat. What is your lubrication? What is your way of building a productive mind that can help you to retain the information, right? And smart studies. I'm going to elaborate it a little bit more. I hope these things make sense. What is support studying? You have to believe in these things. You can't be like, oh, I don't want to study smart, but I want to make sure that I'm studying too much. There's a difference, studying too much and studying smartly. If you're not taking breaks, if you're already tired, if you're tired every day, it's not going to work out. You need to take a step back and think about, am I doing correctly or not? So as I said, you have to create a belief system around you. What you're doing, you need 6 hours break, you need 6 hours rest, you need 6 hours sleep. There's no compromise on that, because if your brain is tired, there's no point of sitting with the books and start working again, right? Let's work on the smart studies. I'm gonna go a little quicker so that you all can see all the points. Mind mapping, think about what it means. Attend live lectures and participate in the lectures. Daily revision, making questions. Then active recall. What does active recall includes? Spaced retention, practice exams, review all the answers. Let's talk about this much first. When I say mind mapping, I want to use a science to study. Everyone has studied about the motor learning program, right? Motor learning program for our cognitively impaired patients, traumatic brain injury patients, stroke patients, all that stuff. What do we learn from motor learning? Why don't we use those strategies in our studying? Cognitive stage, associated state, autonomous stage. Cognitive state includes mind mapping. If you're going to make a plan for yourself, you need to have knowledge of results. You need to be very clear in your mind that you're going to pass the exam, or you need to achieve these targets for this specific day. Mind mapping so that you understand and you have a feedback. Big authors also make very good points when they say write things down as a target, what you want to achieve. I was reading a book, I think it's right here, 7 Habits of Highly Effective People, right? Why somebody has to write this book? 7 Habits of Highly Effective People, because there's a pattern of a human being. There's a pattern that we all fall into. We have our cell phones with our hands, we have our kids, we have our families, and we have our time to give it to them. So mind mapping basically helps you to create a plan for yourself towards the targeted goal. Attend live lectures is important, because in the live lectures with us, you can ask your question and you can clarify some things. It's not just about listening to the content, but if you're typing your questions and if the mentor who is teaching you understands where you're going, if you're going right or wrong, they can actually help you to think better with those kind of questions, right? Daily revision, obviously, making questions. What if I tell you I can teach you how to think like an examiner? It's a switch. It's a switch of thinking like a PCE candidate to think like a PCE creator. What if I tell you, make a question for me on shoulder pathologies, something like that. You're going to make a difficult question. You're like, this guy's been teaching for a long time. I'm sure this guy have a very great shoulder information. You're going to make a question for me, difficult level, because you want to challenge me. What if that difficulty level for me is easy and it's very difficult for you? You see what happened? You went back to the books, you studied shoulder joint, the difficult things that you were ignoring before, and now you're making questions because you want to challenge me. It's called secondary learning. It's switching the perspective. Are you still thinking about taking that validation from someone if I'm right or wrong? Or if you're stepping up the game, if you're leveling up the game and you're like, you know what, I'm gonna figure out things by myself. I'm gonna figure out how to make questions because I'm the person who's not able to eliminate last two options, right? How do I kill that anxiety? I start thinking like an examiner. If you want to talk to me about this strategy a little bit more, I'm happy to discuss anytime. You can text me, email me, or send a messenger message. Cheat sheets like this. This is what I'm talking about, flashcards. Okay, these flashcards, empty, like blank sheets, you can buy it from anywhere, and then you can clip them together, system-wise, topics-wise, or anything. Let's say if I want to study myotomes, then I have all examination notes here, and I just want to go through the myotomes instead of going back to the book and finding the page number. I know where myotomes are, and I'm just going to revise that. Flashcards, cheat sheets are a good source of improving your retention. So anything that you have tendency to forget, turn them into flashcards, and that's going to help you to remember. For example, I have these examples like dermatomes, myotomes, lab values, muscle origin insertion, coupled motion, special test, and reflexes. A lot of people do tend to forget this information. So probably flashcards. So I have these like small flashcards, big flashcards, and some ready to go flashcards, colorful flashcards, so that I can color code my topics and randomly practice them. It's a great way to improve retention. I'm going to say this again because this is a real conversation between you and us. If you expect to make a difference, you remember when I said how to do things differently. What do I do things differently? Retention strategies, generalizability, that's going to change your game. All right. Okay, perfect. Now let's take another case study. Faiza, you helped a person to pass the exam, and we want you to talk about the difference that was made from the first attempt to the second attempt and how things were changed with the course of period. So this is the comparison of your student. You can talk about system-wise, domain-wise, or anything that you change in the strategies. Please go ahead.
Yeah. So this student is a very confident person. This person, like when they contacted PCF and they took one-on-one mentoring with me, like the person was literally devastated. Like, no, I'm not going to continue this. This might be the last attempt. If I'm not clearing this, I'm quitting this job. So this is what his words when he's like the person said to me. I said, okay, let's work on your weak areas where you had made, which made you to fail, right? So everyone has a weak areas and strong areas. So that person said, like, I'm good with everything, but when I just saw the score report, the person was not good with MSK and ethics. So these two are very important to pass a PC exam because we are physios. We should be knowing how the musculoskeletal very good, like to handle it, and the ethics in Canada, ethics is like the number one. Even if you're not making the correct decision too, if you're not ethical enough, you're not going to make any good practice, and you would be the college won't be allowing you to practice it. So these two areas, that person was not able to make it. So I focused on these areas, like where he was weak, that person was weak with MSK interventions. So I just like told that person like how you have to study this. I told him like go get the PCE blueprint. Just see what topics we have to read, because you know what happens when you're preparing for the exam, we read everything, right? We don't even like think, okay, so these are the important topics I have to read for the exam. They don't take it. They just read, okay, fine, I need to read this, everything. So finally, they don't read what they have to study for the exam. Apart from it, they have studied everything. So I told that person to focus only on the PC blueprint, then go with the college websites for ethics, and this PCEFF mocks, like ethical exams and the 3 mocks, those really help that person. And plus, I told that person to go do your questions. Like if you're making, and everyone makes mistakes on the questions, right? So for like, if he's like taking 50 questions and he's making mistakes, I told him to work on the wrong questions and see why they are wrong and see why the other options are right. So you are going to cover the entire thing just by doing the questions. So this made a great difference. And to be honest, like that person was so like relaxed while going for the exam, because during the first attempt, the person even didn't take a break. So
Okay.
in the second attempt, he took a break of 15 minutes, had like some snack, and came back and did the exam. So that was the difference in the second attempt. So that much the person was relaxed to handle it in the
Okay.
4 hours. So this made it, and the result came out. He's passed, and everything was fun. So I'm just happy that person made it.
I'm so proud of you. I have 2 follow-up
Thank
questions
you.
for you.
Yeah, sure.
Okay. Number 1, what would you suggest this person if this candidate is first-time test taker, not the second-time test taker? Because we have a lot of people who are going for the first time, right? They're going to
Yes.
be people probably next 6 months, they're taking the exam for the first time.
True, true.
What would you tell this person to not to do, or to not to think like, or why don't you do this way so that you pass the exam in the first attempt? You understand what I said?
Yeah.
Yeah.
So
Okay.
the thing is, like, the questions are pretty straight, you know.
Okay.
Sometimes we think so extraordinary. For example, very simple question: the muscles of respiration is diaphragm, primary muscle.
Yeah.
That's it. There's
Yeah.
no change in it. But in since you have intercostal, external costal, latissimus dorsi,
Yeah.
you're super confused, and you know the answer is diaphragm, but still your brain is like, no, this cannot be so simple. There should be some
Yeah.
trick in it. There's
Yeah.
no trick in it. It's a very simple question.
Yeah.
So PC is a very, very basic exam, and just for the person who have just come out for their college, freshers to do it. It's not like research exam. So
Right.
you have very simple question, just answer to the question, read the question, with the answer you take, that is the first answer, is right for you. Just
Yeah.
click it.
Yeah. Yeah.
That's it. So
That's a great point.
yeah,
That's
that I'm sorry.
no, I what I was gonna say, like, sorry to cut you off. Like,
No problem. No
what
problem.
you're saying is basically, I call it favoritism. When we are studying something, some things we grab quickly, some things we take time to understand, and because we haven't studied in a long time, we start assuming that this may not be an important stuff. Even during the exam, some of you may be thinking that PC can't be that easy. Why are they asking me such a simple question? Maybe I should go with a different option. Maybe this is not something I'm perceiving correctly. That assumption before exam and after the exam is a killer.
True.
Right?
Yeah. So
the second thing that you mentioned, like, don't assume what is important and what is not. My God, I don't know how universe works, and I have these signs. Now we're talking about it. I had like 8 to 10 calls in last 1 week for the people who didn't pass, and they were studying with somebody, and that person told them that gait is not important, that ankle joint is not important. Why we are doing that to people? On one side, we tell, don't be a test taker, be a physical therapist. And on the other side, we tell them gait is not important. Do you want to become a physiotherapist who enter into outpatient clinic and don't know about the gait and don't know how examine the gait? If that's the goal, right? PCE is to find out if you're competent enough to practice as a physiotherapist in Canada. Why do you want to become a person who doesn't know ankle joint? Don't you think you can have an ankle joint patient? Okay, let me ask you another question, guys. You guys are in practice, right? Ruchi, you are a registered PT. Faiza, you are a resident PT.
Yes.
Can you refuse a patient that I can't treat you because I did not study ankle joint during my PC preparation?
I don't think so.
Right?
That's the exact same point I told one of the students while you were talking. I had this conversation in my mind. Students come and tell us, can you give us some important topics? And what will you tell a person, for example, if you didn't study ankle joint while you're talking about it, come tomorrow, I'll study and I'll treat you. Is that something you're going to do? It's such a practical scenario. You have to understand and know each and everything. You cannot just choose favorites. The second point I would really like to add to this is, do you want to study ankle joint now and clear in your first attempt? Or do you want to later on regret, fail the exam and reappear for the exam again? And then in the second attempt, you are not just reading just the ankle joint, you are reading everything all over again.
Got it.
The
Yeah.
pool of emotions, the time that you have to give, the family time that you're compromising, the money that you're compromising, so many things.
Yeah. Yeah. Agree.
So as a
Agree.
student, as someone who's preparing for the PCE, the choice is yours. Do you want to do it in the first attempt, or do you want to go for the second attempt?
You know, this has to come from the mentor. You can't be a mentor and say, oh, gait is not important. That's not right. That's not a good duplication. What if that person passed the exam? Okay, person passed the exam. Great. We want that for you. And that person become a mentor. What is the duplication we're doing? If that person teaches 100 people in future, that 100 people will never be able to understand gait because gait was never important. Okay, so there are some things that has to be changed. I'm not against anyone. Okay, let's be I respect everyone. I want to respect everyone because we are colleagues. We are not competitors. We're colleagues. Why don't we ask ourselves, am I weak in something? And that humility is a great leadership quality. You're a mentor and you're a leader. You're guiding somebody for future. So it's okay to tell. I would not feel embarrassed to tell one of my students, I'm not sure about this question. Let me study about it. Because I don't call myself a perfect physiotherapist. It's just like you're sitting with let's say if we are working in the same clinic and you bring up a patient to me and you're like, Ravneet, I need your suggestion. What if I'm not expert in that? Of course, there are some topics that I'm not 100% with. Of course, there's something that I don't use every day. For example, cardiopulmonary. I don't see cardiopulmonary patients at all in my practice, but I still have to study it every time I want to deliver a lecture because if you go to, guys, you haven't seen the cardiopulmonary lectures for recently, but if you go to the slides, you'll see there are so many things. I try to keep adding, I try to keep change questions. I try to bring new things in the cardiopulmonary because sometimes I have to go back and study. And I'm saying it out very loud that nobody is perfect. Instead of telling somebody, why don't you study? And then ask me a question instead of why don't you as a mentor study and answer the questions? Because that's why you became a mentor, to teach somebody, right? But again, this is a topic for another probably conversation. But what we are trying to do, Faiza raised very important points. It's okay to accept that I don't know everything. And implementation is very important. If you don't know something, you need to study that first, right?
True. I just want to add one thing.
Yeah.
Like, before, like you said, like they have a different perspective. So before going into the examination, even before starting, when you meet some people and you just ask, they just start saying, oh, PC is so difficult, you cannot take it. That just 3 attempts, you're going to fail. It's so difficult. It's not like that. Every exam is difficult if you don't study. Every exam is easy if you make it. That's it. I really felt like after giving the exam, I felt like I was answering the questions from the first year when you answer the questions in the college. They were like that to me. So even my students said that, like it's very easy exam. The only thing is like your brain is like already, what to say, like prepared. This exam is difficult. You're not knowing anything.
It's a mind game.
Exactly. That's it. You have all the knowledge. The 4 hours, just concentrate and do it. That's it. Everything is in your hands.
Yeah. I completely agree with that. All right, guys, let's keep moving on. All right, I think let's talk about some of these study strategies again. I'm going to show you a question. It's a vignette question, but with one stem and one question because I want to make a point over there. So I'm going to show you a screen which has a question about a spinal cord injury patient who have gone through the cabbage for about 3 years back. And it's a distractor. The patient is ASIA scale C at C7 level, right? What does ASIA now? What would be a better recommendation for a wheelchair for this patient? There are multiple levels to this question, right? Number one thing that you need to know about this question is, what is ASIA C? ASIA level C. Then what if patient has spinal cord injury C7? What muscles are intact and what muscles are good to go, right? And then you need to know that the different types of wheelchair. Now you see, home proctoring is a thing that you can take the exam anywhere in the world. In order to answer this question, you have to think like a Canadian physiotherapist. You have to know about the equipment that can be used in Canada. Probably there are different kind of wheelchairs, like one hand rim wheelchair, joystick wheelchair, transport wheelchair, manual wheelchair with friction projection hand rim. Maybe that was not used during my practice when I was practicing in India. But now when I practice here, I see these things and I'm okay with these things because I've practiced enough, right? But what if you have never seen these things? So there are multiple levels, types of wheelchairs, what activity a patient can do with a spinal cord injury, what is ACSC? Now there are multi-levels of this question. If you're just reading things superficially, then you're like, yeah, C7, that means patient can use the triceps. That means I can do one hand rim wheelchair, patient is okay. Maybe not. Maybe you want to go with power wheelchair is not the right answer because that's usually for the people who are high cervical cord injury patients, or patient can use power wheelchair with joystick because in the community, not inside the patient can use a regular wheelchair. Transport wheelchair does not have big wheels to propel. It only have casters front and back. So there's no point of giving that kind of wheelchair. So are you able to eliminate on the basis of what is Asia C, what is C7, and what are the different types of wheelchairs, instead of just looking at a question, C7, okay, I'm gonna give this kind of wheelchair. So there are multiple levels of this question. It's not something that we wanted to discuss because this is not a content lecture, but this is a kind of therapist that you want to become, who can think different levels at a specific time. So this is just one question. If you want to talk about this particular question to me, so go ahead and email me. Maybe we can talk. What do you think and what should be the right answer? Or maybe you are typing an email already with the correct answer already, right? Okay. Let's look at some final things, what to do and what not to do for preparing the PCE. All right. Ruchi, would you like to talk anything about in the do's and in the don'ts of anyone who's going for the PCE exam?
Yes. So the most important part is understanding the concepts. I would really, really focus on that point. If you don't understand the concepts, you are just laying your foundation wrong.
Right.
And trust me, no matter how hard you work without not getting your concepts, you are not going anywhere. I may sound rude and I am sorry for that, but I'm not sorry for that. You have to understand the concepts, and that's how you are going to progress towards passing the exam. When I say progress towards passing the exams, because there are next steps to follow once you are understanding your concepts. You're practicing, you are revising, you are capable enough to connect the dots once you understand the concepts. It makes you capable enough to use the exam taking strategies once you understand the concepts. You don't have to keep mugging everything if you understand the concepts. There are so many things that can be covered, or the foundations can be just laid correct just by understanding the concepts.
Right.
And trust me, if you understand the concepts, they stay with you for your entire life. And I can assure you for that. That's how it's going to work.
Right.
The next thing is taking full practice exams. Your brain, your body, physically, mentally, emotionally, your eyes, it really has to train for the exam day. If you have not sat in front of computer screen for 4 hours at a stretch, solving 200 questions in an exam atmosphere, if you have not done that in the past, you are not going to be able to do that in the exam. Trust me. You need to prepare your body for the 4-hour exam in
Right.
different ways, understanding the questions, solving the questions in particular time, giving yourself some time to go back and understand, revise the questions if you are in doubt. All of these things need practice, and it cannot be done on just the exam day if
Right.
you haven't practiced it in the past.
Right.
Reading from the books and planning your approach, setting yourself the goals. The most important part is I would say every part is the most important part because everything is important.
Right.
Setting the goals, fulfilling the goals on time is what is going to keep you consistent and on time, on targets towards your PCE exam.
That sounds good. One thing that I would like, Ruchi, you to elaborate a little bit more on, like when you start studying the textbooks, you feel lost, right? So when we say reading the textbooks, what exactly you mean by that? Like I know what you mean, but I just want you to elaborate, like, how do you segregate the readings? How do you make sure that you're reading enough to understand the concepts? Can you take an example?
Let's say, for example, shoulder joint.
Yeah.
You cannot just directly get into what is adhesive capsulitis
Right.
without understanding the concepts of muscles in the joints.
Good point. Yeah.
You cannot treat adhesive capsulitis without understanding the concave and convex rule.
That's
For
true.
the mobilization, for example, you have to understand what's going on in the literature, what treatments are accepted, how they're accepted. So really, again, it again comes down to the concepts.
Right.
You cannot get to studying any condition directly without understanding the concepts or the basics behind the joints,
Right.
behind the muscles, how different muscle contractions work, how what are different capsular patterns.
Right.
Studying these things would help you understand differential diagnose the conditions.
Right.
It will give you the confidence to choose the correct answer while you study all these things. So that's how it is. If you're picking a shoulder joint to study, start with basics. Understand the muscles, know the muscle action, the muscle work, understand the bones and the joints, some of the important the targets of the points of the bones, which you will have to be aware about, and then move towards the conditions, because that's going to help you set the foundation right.
That's a great point, Ruchi. A person who's studying, if I just say frozen shoulder, the thing comes into my mind: adhesive capsulitis, the capsular pattern, the stages of the frozen shoulder, the most common glides comes into the frozen shoulder. And if we're talking very generally, you're like, I know this topic, but what if I make a question on a frozen shoulder, and if I say this muscle, this activity is impaired, what is going to be the trick movement, what is going to be the coupled motion, what is going to be the synergist to this motion, this particular muscle. And that's when you feel like, damn, I never thought about adhesive capsulitis in this way. I studied this topic, it's familiar to me, but I never thought about it. This is what we call do things differently this time, right?
Exactly.
Yeah. All right, perfect. Moving on to something that you can start working on. If you're taking the practice exams, now let's talk about overall plan, like what you want to do. If you're a first-time test taker, second or third, doesn't matter. What you want to focus is building your stamina. Just like Ruchi said, you need to have 4 hours stamina. It's okay, you're solving 20 questions, 30 questions every day, but that doesn't mean that you don't sit for 4 hours and take the mock exam, right? Determine your weak areas, right? You should not avoid, I always say this, if you're going for the second attempt and you look at the blueprint of the PCE and you're like, these are the topics that I want to do it on Sunday because I'm not very much comfortable with that. No, you want to do those topics today. Start today. You don't have enough time, that's okay. At least start today. Do not keep them for weekend because you have enough time. The major reason you're keeping it for later because you're not comfortable with that. You're like, I need a specific atmosphere to work on those topics. No, you just need a right mind setup. Determining your weak areas and working on that is very important. For example, shoulder joint adhesive capsulitis, right? And I've said it many times. Most of the people start studying from the shoulder joint, and by the time they reach ankle, they've lost their motivation. Why not starting from ankle this time? It's challenging, and of course, you're going to pass the exam because you're taking the challenging stuff first. If you start with the shoulder joint again, you're already comfortable with that. You don't want to read that too much. You want to read ankle joint, wrist and hand, because that's where you're missing the points. Simulation to the PCE, like try to take online exams instead of taking the paper exams, because you're going to sit in front of the camera screen for about 4 hours, more than that. And you need to build that eye stamina, mind stamina, body stamina, your back stamina. There are unique stories out there. Somebody who's pregnant, somebody who's 6 months pregnant, doesn't have a lot of back stamina. So what do you do for that? You know you're going to take the exam in July. Have you started doing your posterior pelvic tilts? It's just a very simple thing to do, because you know posterior pelvic tilt can reduce the back pain, can build the stability in your back. Are you doing that or not? It's just one scenario. I'm not trying to point out the pregnant woman here. I'm just trying to say, you know your condition, what your condition is going to be next 3 months. Are you working on that or not? That's what practical approach is. And everything requires planning. Improve retention, just like flashcard strategy. If you have any other strategy that helped you before to improve your retention, let's say if you fail the exam because you were not good at a specific domain, that doesn't mean that you're only focusing on that domain. You still have to read everything again in order to make sure that you pass the exam with good points. So retention is important. Flashcards or notes, random practices are a great source. Having a mentor is a great source for retention, because your mentor is challenging you on different topics. All right. So I believe this is how you build your retention. And I think this is, if you're like, I've worked this before and it didn't work for me, I want something else, reach out to us, right? We still have some things to talk and some questions to take, but next weekend on same time, we're going to do a podcast on neurology, because MSK is the most common practice in physiotherapy and neurology is the second most. So we want to talk about neurology, like how to remember the tracks, how to remember the overlapping information in the neuro. And we want to make sure that we give you enough information when you're planning, when you're making a plan to study your neuro, it is worth spending that time. So next Sunday is going to be all about neurology, right? All right, so this was a little bit of the presentation and some examples of what a person was doing before and what next. Now, I think we can take some questions from the live chat, and let's see. All right. Okay, we have a lot of questions here. For now, we want to know more about May PCE. All right. We have, I want your insights on ethical scenarios. Every person has a different perspective, and everyone who's setting a certain set of scenario might be different from some other perspective. Hussein, that's a very good point. But what I want to say is, think about a perfect world. What would you do in a perfect world to protect your patient? If your ethical scenarios and if your thinking is going towards protecting your patient, I think you're going to make a good choice. But yes, you do need to have content. You need to know about a lot of stuff like autonomy, beneficence, respecting their rights, and protecting the information and all that stuff. So if you want to talk more about your ethics scenarios, Ruchi is great with ethics. So if you want to talk to Ruchi, even Faiza, she helped me to write a blog. So the blog that we have written on PC Final Frontier, ethics blog, that's written by Faiza completely. So if you want to talk about ethics scenario, and if you want somebody to sit with you and throw some scenarios at you and do a practice, these two people are a great resource for the ethics practices. All right, Radhika said, yes, most important is to understand the physiology of the conditions. That is great. All right. I was thinking that we have to think out of the box, but you clear. Okay, perfect. What are the strategies that could help solve questions? I use elimination. Kirti, that's a great strategy, elimination. Mostly the questions have keywords. But now, what do you do if, and it's a very common scenario, like you look at a question and you're able to eliminate first option, you're able to eliminate second option, and you're like, man, I'm still stuck with between these two options. Strengthen your concepts, strengthen your content. That's one thing that you can do. When you're taking the mock exams, are you are you a person who wants to check how much am I scoring versus you're a person who wants to check, there's a pattern that I'm getting these answers right and these answers wrong. If you're strong at looking at the pattern, for example, is somebody who is making more mistakes in interventions, that means that person has to start focusing on the interventions. Mock exams are not just to look if you're ready for the exam on the basis of only scores. It's important because that gives you an opportunity to look at your weak areas, to look at a pattern if there's a pattern or not. So try to look at a pattern and talk to one of the mentors, and probably they'll sit with you and help you, throw you some more questions, and see if you can work on the strategies. All right. Anything else? Great. Okay. Before we end the session, Ruchi, Faiza, let's go alphabetically again. Faiza, do you have anything additional that you want to cover? Any advice for somebody who did not make it in the March exam and you want to advise something and see if they can work on it?
I think like we have covered everything. The only thing I want to say is like, don't give up. There's nothing like a failure in life. If you fail, you're going to get success again. So just don't give up. Work hard. You already have worked hard. Work smart. And for sure, the next time will be your success. Just don't give up. That's it.
Perfect. Ruchi, anything?
I like few of the things. The very first important thing is, as I said, don't give up. And the second important thing I want to tell you is you are not answerable to anyone else but just yourself. So if you think that you're achieving your goals for others to meet others' expectations, you're not. So stop being answerable to others. You don't have to be. You have to be answerable to yourself. Keep the goals for yourself. Just work for yourself, and you will be able to do it. You can do it.
Yeah.
Don't feel pressurized. Someone else did it. I was not able to do it. What is my family going to think, or what is XYZ person going to think? No. Well, how do you want to make a difference? Think about that. You have failed it. You cannot change anything about it. What you can change is what about your next approach or your next step. Yeah. So work towards that. And we are here always for you. Feel free to reach out whoever you want to get help by. We are as a team, so we are always supporting you. And if you approach one person, trust me, it's not that person working with you, it's the entire team behind that. You may just see that one person, but it's the entire team that's working with you. That's all. Thank you.
All right. Thank you, Ruchi. I know we have some comments, and I had some emails about I flunked the exam by very few points, and it's heartbreaking. I understand that, but I think what you need to do is look at the report. That's number one, and see where you can make the difference, and start working on the things in a different direction. Whatever strategies that you see, you have to study everything again. You can't go like, I'm going to study this less or more. You have to study everything again. And that would be a very smart move to go. But try to look at your practice exams. The motivation has to come from within. The motivation has to come from your surroundings. Just like Ruchi said, there's nobody who's judging you. You're not answerable to anyone. You're answerable to yourself. Take your time. Take your time. Nobody's asking you to start right away. Take your time and think about when you want to get back to the studies, but don't take too much time, because if you take that too much time, then it'll be difficult for you to come back, and the stamina that you've built, you're going to lose it. So we all wish you good luck, and we all wish you a good health, a good mental health as well, because this can be a lot taxing on your brain. So we are with you. We will stand with you if you need any additional help. I just wrote my email ID in the chat box. So feel free to email me for any questions. If you want to talk to me, we can book a call and we can talk about that. But hey, the reason why we started doing PCE podcast is to bring a different perspective out there and to connect with people who can take benefit from the conversations. We'll see you guys next week. weekend on Sunday again, same time, 12:30 Toronto time, and I'll bring experts on the neurology, and we'll discuss a lot about how to study, how to remember, and what is the best way to go to improve your scores in the neurology. Till then, you all have a good one, and we wish you all good luck, and we'll see you guys next weekend. Thank you. Thank you, Ruchi. Thank you, Faiza, for being part of our very first episode of the PCE podcast. And I'm so happy to be live with you guys.
Thanks, Ravneet. Thank you, Ruchi, for like sharing everything. And I'm so happy that I'm part of you guys.
Thank you, guys. It was a pleasure being today here. Thank you.
Awesome. Thank you, everyone, for joining in. All right. We are good.